Good evening. Today I'll be speaking on the topic Anatomy of External Ear. External ear is divided into auricle or pinna and external auditory canal. Let us first talk about the auricle or pinna. Development. It develops from 6 hillocks of his around the first branchial cleft. The structures that are derived from the 6 hillocks numbered from 1 to 6 are: number 1, tragus; number 2, crus of helix; number 3, helix; number 4, antihelix; number 5, scapha and antitragus; number 6, lobule. The developmental anomalies related to these are: number 1, preauricular sinus, which results due to defective fusion of these tubercles. Number 2, bat ear, which results due to faulty development of the 4th hillock, leading to a defect in the formation of antihelix, leading to bat ear deformity. Number 3, anotia and microtia. Anotia is the absence of pinna. Microtia is a smaller pinna with the structures retained. Anotia is usually linked with thalidomide intake during pregnancy. Moving on to the structure proper of the external auditory structure proper of the pinna. Pinna consists of a single piece of yellow elastic cartilage throughout except at the lobule. There is a place in between there is an area in between the crus of the helix and the tragus, which is known as the incisura terminalis. Incisura terminalis, because it is named so as incision can be made in this area, end oral incision, as this area is devoid of cartilage and is formed of fibrous tissue. Now, the gross anatomical structures in the pinna are the helix, which is the most prominent part. Then we have the tragus, antihelix, antitragus, scaphoid fossa, triangular fossa, concha, which is divided into cavum concha and cymba concha, and the lobule. Now let us move on to the importance or the parts importance of these parts. Now you know that the pinna is divided has two parts, the medial two surfaces, the medial surface and the lateral surface. Which is prominent anteriorly is the lateral surface and the posteriorly is the medial surface of the pinna. So the speciality of the lateral surface is that the perichondrium is tightly adherent to the cartilage here, and hence you will find cases of frostbite along the lateral surface. In the medial surface of the pinna, there is subdermal tissue and which leads to the formation of sebaceous cysts along that area. Now let us move on to the nerve supply of the pinna. Grossly, the upper 2/3 of the lateral surface is supplied by the auriculotemporal nerve, which is a branch of the mandibular division of the 5th nerve, that is V3. Then we have the upper part of the medial surface is supplied by the lesser occipital nerve, and the lower part of both the lateral and the medial surface, especially the lower 1/3, is supplied by great auricular nerve. Nerve supply of pinna is very important while we discuss the causes of otalgia. Now moving on to the blood supply. It is supplied by posterior auricular artery and superficial temporal artery. Lymphatic supply, it is lymphatic drainage. It drains into preauricular nodes, postauricular nodes along the mastoid tip, and the upper deep cervical nodes. Now, what are the applied anatomy of pinna? In rhinoplasty cases, the cartilage, especially the conchal cartilage, can be used to repair the defects of the nasal bridge. That is, in depressed nasal bridge cases, we can utilize this conchal cartilage. In tympanoplasty cases, we can utilize the conchal cartilage, the tragal cartilage, the perichondrium over the concha, and the fat from the lobule. Now, we can also utilize composite grafts of the skin and cartilage in repairing the defects of nasal ala.